Hi Donna, this is my catheterization video. The first thing I would do is I would check my doctor's orders to see what kind of Foley catheter he has ordered. Once I have received that, I would go into my patient's room, first wash your hands and check the patient ID, make sure that the patient knows and understands what you are doing, and some techniques to help the patient out while doing the Foley catheter. Next, I would get my Foley catheter. Sometimes people do use these as garbage bags, but I am not. I just have the garbage set over here. Okay, to open this, you go like this. Make sure it's kind of bent. Okay, these are the gloves. I will set them aside. Here is our drape. And we will open it, grabbing this side, the shiny side out, and then you fold it and walk back towards your patient. So it is like this, shiny side down. Okay, this drape we do not use. You will then put on your sterile gloves. Once you have your sterile gloves on, you cannot touch anything below the waist. In this kit, you have iodine swabs that you will set out. I won't be using them, I will just be demonstrating how to use them. You set them out on your tray. Next is the lubricating jelly. Now the next thing you do want to do is you want to separate your boxes. Here's our specimen cup. Put that over there. First thing you do is check to see if the balloon is okay, and it probably works. Some manufacturers have you do this, some do not. And you just insert it and watch for the balloon to pump up, and it did. I am going to leave that attached once the balloon is good. Make sure you have a good hold on this. And I'm going to lubricate there. Okay, then the next thing I am going to do is I am going to take my left hand and pull back the labia. And I'm going to go to the right side and off the sterile fill. Then go to the left side and wipe off to the sterile fill. and then down the middle. I am now ready to insert my catheter. You lubricate about 2-3 inches. You locate the urinary meatus and you insert the catheter. Then you insert the catheter 2 to 3 inches or until you see urine. When you see urine present, you insert another 1 inch. Now that it is in and I have noticed urine, I will release the labia and I will hold the catheter with my left hand. I will come back here and insert the fluid. You need to make sure that you hold on the plunger, otherwise the plunger will fill up. With this hand, you need to give it a slight tug to make sure that the catheter is in place. You come back here and unhook the syringe. And that is catheterization. Now you can clean up your sterile film. This would be the time to where you change your gloves. Make sure that your patient is covered up. Don't have a blanket, but I would cover my patient up. And then you would finish this. The first thing you would do is you would strap this or tape this to your patient's leg right at the Y, so this is more flexible. And then you would hang this on a non-movable part of the patient's bed. You can cover your patient up and do your charting, data, action, response, plan, or evaluation. Okay, now that the catheter is in place, I have received doctor's orders to do a sterile or a clean specimen of urine through a Foley catheter. I would ID my patient, tell my patient what I am doing, that I have to get a urine specimen, and the doctor also wants me to remove the Foley catheter. If for some reason that there is not urine in the tube, you would bend the tube in half and clamp the tube. You can only leave the tube clamped for up to 30 minutes. Anything over that, you need to unclamp it. So once that is in place and you see urine in here, you need to get a alcohol wipe and you wipe the port in a circular motion. Once that is done, then you get your syringe and you go in at an angle. Okay, and once you're in, you would pull up 3 to 5 cc's of urine. Once that is done, then you grab this, you unclamp the catheter, you get your specimen cup, make sure you have the lid down, and you inject your urine, cap your needle, put the cap back on, and then you need to date, label, and time your specimen cup. This urine has to be at the lab within 15 minutes. You would also dispose of your needle in the cup, or in the needle placement. Okay, now that the doctor, he has asked me to take this catheter out, I would change my gloves from the specimen cup, and I would get my supplies. I need a towel and gloves. Okay, you need to place this there. Here is the syringe. You need to prime your syringe to get the fluid out. Once all the fluid is out, you would also note on the catheter it says how many cc's that the balloon inside would take, or you would look in your nurse's notes to find out how many cc's are actually in the balloon. This one says 10 cc's, or 10 milliliters. 5 to 10. Well, now that all that is out, let's set that over here, and you are going to pinch with this and pull slowly. Once out, you would make sure that everything is intact, that you're not missing any particles or anything, and it is good. You would take your gloves, and then you would dispose of the catheter in a biohazard bag. You would also note that make sure the patient is doing okay, make sure he has no pain, make sure you do pericare after you have taken the Foley catheter out, and make sure the patient is good. Then you would also document in the patient's chart that you got the urine specimen, that it was down at the labs, and that you took out the Foley catheter, what time you took out the Foley catheter, how much urine was in the bag when you took out the Foley catheter, and what kind of catheter you took out. And then you would check on your patient every so often to see how he or she is doing. And that would be my skills.